Hello? Oh. Okay. So number 5, PTH increases the concentration of calcium in the blood while decreasing the amount of phosphate. So you can think of this in the context of hyperparathyroidism. Where we have high secretions of PTH, parathyroid hormone, and this leads to an increase in calcium absorption, and it inhibits phosphate reabsorption. Number 6. Hyperpigmentation is a result of increased flame. This characteristic is a known symptom for what? Yes. So PO1C is a precursor for what other hormones? There's 3 of them. What part? No, no, no. PO1C is from the intermediate lobus pituitary gland, right? MSH, ACTH, and then endorphin. And then the one that's responsible for hyperpigmentation is MSH. We also have ACTH being secreted from the anterior pituitary gland. So 7. Which type of diabetes is usually obtained later in life and is characterized by insulin resistance? Type 2 diabetes. And it's usually a receptor problem. It can't recognize the insulin. It's not that there's underproduction of insulin, whereas that's the case in diabetes type 1. It's just going to be that the receptors on the cell membrane surface do not recognize insulin. So it's a mutation. Number 8. What are the 2 inhibiting hormones of the hypothalamus, and what do they inhibit? So we have somatostatin, and then we have dopamine. Somatostatin will inhibit growth hormone, and then dopamine inhibits prolactin secretion. Which of the following is the effect of aldosterone in the body? When I'm looking for the effect of aldosterone, I'm thinking of hyperaldosteronism. Okay. And what 2 effects does hyperaldosteronism have? Good. So we have hypernatremia, which is going to be sodium reabsorption, and then we have hypokalemia. Which is potassium secretion. So which one is the answer? The posterior pituitary produced which of So which of these hormones were produced in the posterior pituitary gland? Yes, none of the above. Remember that no hormones are actually produced or synthesized inside the posterior pituitary gland. They're stored there. They're going to be produced from the supraoptic and paraventricular nuclei of the hypothalamus that are then connected to the posterior pituitary gland. And then those are going to be producing oxytocin and ADH, which is then stored in the posterior pituitary gland. But with the anterior pituitary gland, we have 6 hormones that are produced. So the adrenal medulla, number 11, the adrenal medulla secretes what? 8? So where is B, C, and D secreted from? Good. So these 3 are secreted from the adrenal cortex. So the catecholamines here are going to be norepinephrine and epinephrine. TSH stimulates the secretion of what? That's one of them. So yes, P3 and P4 is correct. And C, exactly. So we have TRH from the hypothalamus. We have TSH from the anterior pituitary gland. TSH can produce T3, T4, and then prolactin. Will cause the secretion of them. Okay. Number 13. NSAIDs, which is non-steroidal anti-inflammatory drugs, inhibit blank enzyme, which is harmful to the temperature center of the body, which is located in the hypothalamus. So what enzyme do we want to inhibit to stop you from occurring? Yes, cyclohexamine. So this pathway begins with arachidonic acid, which is converted by cyclooxygenase into the prostaglandin, PGE2. This then causes an increase by irritation in the temperature center, so an increase in temperature, and then that leads to fever. So the non-steroidal anti-inflammatory drugs will be inhibiting this enzyme from converting arachidonic acid into the prostaglandin. Number 14 and 15 involve the male reproductive system. So FSH, which is the follicle stimulating hormone, acts on which cells to secrete what? Which regulates what? So what does FSH act on? Sertoli cells. To secrete what? Inhibin, right? And then that regulates spermatogenesis. This is occurring in the testes along with what LH2 will act on. So inhibin can inhibit by negative feedback FSH if there's too much sperm being produced. the S in FSH for Sertoli cells, and then LH, and then the LH later. So LH acts on Leydig cells to secrete testosterone. This is also happening in the testes. Number 17. Which of the following will not bind to nuclear receptors? No. Okay, so what does steroid hormones, vitamin D, and estrogen have in common? What is their precursor? Cholesterol. So steroid hormone, vitamin D, and estrogen, their common precursor is cholesterol. And cholesterol can easily diffuse through the plasma membrane, correct? So growth hormone, and then they bind and act on the nuclear receptors. But growth hormone will not bind to nuclear receptors, so what type of receptor will it bind to? Exactly. So growth hormone will bind to cytokine receptors. Number 8. Oh, thank you. Can't see that one. Okay, so number 16. Nuclear receptors are located on cell membranes. True or false? It's false. Number 18. Uterine contractions are under the control of blank and blank. What are they under the control of? Yes, oxytocin is one of them, and then prostaglandins will also be one. Number 19. PLMC gives rise to which three hormones? It's going to be ACTH, MSH, and endorphins. Remember that MSH is the melanocyte stimulating hormone, and that's going to lead to hyperpigmentation and overproduce. Number 20. Which enzyme is responsible for converting cholesterol into steroid hormones? Which one do you guys think it is? Yes. Okay, so number 21 is a fill in the blank. What is the connection between the hypothalamus and the anterior pituitary, and what is its role? It's a very long name. It's the hypothalamo for hypertension and hypokalemia. So hypokalemia means low potassium in the blood. Although he takes oral potassium supplements. The computed tomography shows that he has a mass in the right adrenal gland. What is the most likely diagnosis? No. Yes, it's C, Cohen's syndrome, or Cohen's disease. That's also hyperaldosteronism, right? So just remember that these two are the same. Cohen's disease and hyperaldosteronism. Dr. Akbari could use either one on the exam. So hypertension is usually characterized by high sodium levels, right? So that would be the part of hypernatremia, and then the low potassium is hypokalemia. So what part of the adrenal gland is this mass located on? The cortex or the medulla? Cortex, yeah. So if it was the medulla, then it would be oversecretion of norepinephrine and epinephrine. And that would be pheochromocytoma. Number 23. What are the zones of the adrenal cortex and what do they secrete? Okay. So we have 3 zones of the adrenal cortex. And then this part will be the adrenal medulla. The adrenal medulla produces the catecholamines, such as norepinephrine and epinephrine. To remember the adrenal cortex, it usually uses mnemonic growth progression equals to. So the first one will be with the G, right? The second layer will be F, and then the third will be an R. So this is zona glomerulosa. That will secrete the mineral corticoids. Such as aldosterone. Then this is the zona vasculata. And it will secrete the glucocorticoids. And what's the glucocorticoid that we know about that's secreted from the adrenal cortex? Cortisol. Good. And then the last layer will be the zona reticularis. application of the fertilized ovum. What's responsible for it? Which one? Yes, progesterone. When we see decreases in progesterone, that's bad and has to just lead to an abortion. 25. Insulinoma is a tumor of insulin-secreting cells. When we have high levels of insulin, then blood glucose, blank, and then we have the condition of blank. So what happens to blood glucose levels if we have a lot of insulin? It decreases. Good. So that's going to be hyperglycemia or hypoglycemia. Yeah. If fertilization does not occur, the corpus luteum degrades and is replaced by what? Yes, corpus luteum. So this is the white scar tissue that will replace the corpus luteum if not fertilized. 27. The corpus luteum secretes what two hormones? Yeah, progesterone and estrogen. Ovulation is triggered by a certain what? A. Yeah. So luteinizing hormone. So when does ovulation occur? Mid-cycle. Okay. So it's mid-cycle, right? It's day 13, 14, and 15 of the menstrual cycle, which is 28 days. LH is responsible for the follicle rupture, and then for the follicle to then leave the ovary and then travel to the fallopian tube. This is the best time to get pregnancy as well. So LH is responsible for rupture. And follicle. 29. The first hormone secreted by the placenta is what? Yes, it's HCG. And then HCG is responsible for maintaining the corpus luteum. Diabetes type 1 treatment is most effective if insulin is taken orally. True or false? It's false. Why? Okay. So it's false, and that's because insulin is structurally a protein, and proteins are degraded in the cell. Okay. So it's better if it's injected intravenously. So 31. important for the descending of testicles from the abdominal cavity into the scrotum. Yes. Sasha, please. $32. What's the difference? Androgen is for both males and females. Yeah. And then if there's overproduction of it, then that could lead to the inhibition of estrogen, which we know being produced for testosterone. And then that would lead to infertility. 32. FSH and LH are secreted by what organ and are under control of blank, secreted from the hypothalamus. 8. So FSH and LH are secreted by the anterior pituitary gland and they are under the control of gonadotropin releasing hormone. Whenever you guys see releasing hormones, remember that those are coming from the hypothalamus. Right? We have secreting hormones that are coming from the anterior pituitary gland. So look like this. Think about it. Right. What's the cause for calcium? For the answers. Hypoparathyroidism. Are you guys familiar with 25-hydroxy polycalciferol? And then is the inactive form of the hydroxy. And she has gained type 2 diabetes. So this is more characteristic of type 1. Molecules of DIT combine, blank is formed, and you guys should be familiar with how T3. And then if the female is bleeding, but if she doesn't, stays dormant until puberty, and it's under the control of oocyte maturation. 42. And then the step is reading this and using the red is what? It was 40. Answer will be D. Which part of the sperm provides PCB for movement? But then the most important part is indicating signs of bradycardia. The answer will be D. Durable. So we need calcium also leads to the same problem, but underproduction. What is the primary? Are at a fixed population and are not. Sertoli cells account for 80. And this is by the mechanism of negative feedback, right? Land. Right? And we have the H being produced from the hypothalamus. 52. Which complement proteins are to protect the host against primary adrenal insufficiency or Addison's would have a high serum ACTH. True or false? This one will be true. Remember that this is primary and not secondary, so it's going to have negative feedback, right? So negative feedback is going to involve CRH from the hypothalamus, ACTH from the anterior pituitary, and then we have our three hormones, right? Aldosterone, cortisol, and then androgen. So in the case of us having low levels of these three hormones, so if all three of these were low, right, we'll have a negative feedback to the hypothalamus and or anterior pituitary gland, and that will cause an increase in these. So that's why somebody with primary Addison's disease will have high serum levels of ACTH. If it was secondary, would they have a negative feedback? No, they won't. So this is primary because it's occurring inside of the organ. No. The negative feedback would be from the organ. Number 4. Long-term administration of glucocorticoids leads to adrenocortical atrophy. True or false? This one would be true. Remember that the glucocorticoids, so this could be iatrogenic, so the physician is inducing too much production of cortisol, right? So then that could lead to Cushing's syndrome. Number 5. Secondary adrenocortical insufficiency, so secondary Addison's, is characterized by hyperpigmentation due to excessive secretion of melanocyte-stimulating hormones. True or false? This one is false. So we saw hyperpigmentation in primary Addison's, right? So why we see that is because we have the pituitary gland. This is the intermediate lobe, and the intermediate lobe will secrete POMC. POMC is the precursor for ACTH, MSH, and endorphin. When we have a negative feedback, and then we have low levels of aldosterone, cortisol, and androgen, it'll go back to the pituitary gland, right? So going back to the pituitary gland, we have ACTH secreted from the intermediate lobe along with the anterior pituitary gland. Oh, the anterior pituitary. So then we have overproduction of POMC, and then increase in ACTH, MSH, and endorphins. The MSH is increase in ADH secretion occurs in response to what? B? It will be B, right? Because diuretics make you urinate, so antidiuretic hormone will cause for reabsorption. So then we want ADH secreted when we are dehydrated, and we want to increase reabsorption of water in the collecting tubules of the kidney, of the nephron of the kidney. Okay, so I just answered some. 7, antidiuretic hormone increases what? You guys know this one now. Which one? Yes. Water reabsorption in the collecting tubules. In comparison to T3, T4 is, yes, it is more abundant in circulation. Number 9. Adrenocortical hormones are all derived from the common precursor molecule E. 10. Which response to an injection of ACTH indicates a primary adrenal insufficiency? The answer will be A. No change in serum glucocorticoid levels. Number 11. A laboratory finding that would help confirm the diagnosis of aldosterone deficiency is what? Which one? Oh. Yes. Hyperkalemia. Okay. So think of it in the context of hyperaldosteronism, right? So this one is asking about aldosterone deficiency. Hyperaldosteronism was characteristic of hypernatremia, right? And then hypokalemia. So this is excess aldosterone. If we have a deficiency in it, then we're going to have hyperkalemia and then hyponatremia. Make sense? Okay. Well. Glucagon is secreted from pancreatic beta cells. True or false? This one is false. So where is glucagon secreted from? Yeah, so the pancreatic alpha cells, right? From the beta cells, we then the delta cells are going to secrete somatostatin. The underlying pathogenic mechanism for both type 1 and type 2 diabetes is what? Yes. So impaired glucose transport into the cell. So type 1, we have low insulin levels. Type 2, we have normal insulin levels, but their receptors on their cell surface are not recognizing insulin, so then you can't get glucose transport. 14. At the midpoint of the menstrual cycle, ovulation occurs in response to what? It will be a decrease in estrogen. So ovulation occurs approximately how many days prior to the first day of menstruation? It will be C. Remember day 13, 14, and 15 for ovulation to occur. Number 16. During the first 2 weeks of the menstrual cycle, the endometrium proliferates under the influence of what? The first 2 weeks of menstruation. So, no. So this is not, both of these are more involved if the female is pregnant. So there would be increases in these two. If she's not pregnant, then she's going to have a decrease in this for the last phase of the menstrual cycle. But for the first 2 weeks, so the first 14 days of the cycle, we're going to have the endometrium proliferating under the influence of estrogen. The corpus luteum, what? Yeah, it develops at the site of a ruptured ovarian follicle.